Gentlemen, I want you to imagine waking up tomorrow morning with the very firmness that you have not felt for many years. No pills, no pumps, or risky procedures. You will only be using your own hands and a few minutes of simple yet precise stimulation to awaken your body's natural erection mechanism. I am Dr. Kromova, a specialist in men's health with over 15 years of experience helping men restore their sexual vitality. And today, I am going to show you 3 specific pressure points on your manhood and the surrounding area that can help restore morning erections by improving blood flow, relaxing the correct muscles, and enhancing nerve responsiveness. If you have been missing that automatic morning rise, then stay with me, because by the end of this story, you will know exactly where these points are, how to stimulate them safely, and how often to do it to achieve real results. Before we move on to the where and how, you need to understand why this actually works. Once you grasp the scientific basis of this method, you will realize that you are not just pressing on skin. You are activating one of the most powerful systems in the male body, which can falter with age. An erection is not a random or purely mechanical process. It is the result of a carefully coordinated interaction between your brain, spinal cord, blood vessels, nerves, and muscles. It all begins with nerve signals, tiny electrical impulses that travel at lightning speed from your brain or sensory nerves to the erectile tissue. These signals command the smooth muscles inside the penis to relax, which allows blood to rush in and fill the spongy chambers known as the corpora cavernosa. As they fill, the veins that normally drain blood are compressed, trapping the blood inside and creating that necessary firmness. Now let's examine how age changes the rules of this game. Over time, the blood vessels in your pelvic region can become more rigid due to a loss of elasticity in the arterial walls, a process accelerated by years of wear and tear, mild inflammation, or conditions like high blood pressure. Simultaneously, nerve conduction slows down, meaning that the electrical messages from your brain or sensory receptors are no longer transmitted as quickly or as strongly as before. This double impact, sluggish circulation and weakened nerve signals, is one of the main reasons why morning erections begin to weaken after 50 or even 70 years of age. Targeted pressure point stimulation works because it sends an immediate wake-up call through your entire nervous system. When you press or massage specific points, you activate clusters of sensory nerve endings that are directly linked to the reflex pathways controlling erections. These signals do not remain localized. They travel to the pelvic nerve plexus and even reach the sacral region of the spinal cord, where the erection center is housed. This triggers a chain reaction. The nervous system instructs the smooth muscles in the penis to relax, the arteries to widen, and the blood to flow more freely and abundantly. But that's not all, as some of these points also have a direct influence on the pelvic floor muscles. The hammock-like muscles that support the penis during an erection and help control ejaculation. Stimulating them can improve their tone and responsiveness, which makes it easier to maintain firmness once you have already achieved it. This is why the effect of working with pressure points is often twofold. It can help to initiate erections more easily and also helps you to hold on to them for longer. When you press or massage the right spots, you are essentially bypassing some of the age-related slowdowns and giving your erection system a direct, hands-on boost. Think of it like rebooting a computer. You are clearing the lag, refreshing the signal, and allowing the hardware and software to work together smoothly again. When performed regularly, this type of stimulation can retrain your erectile reflexes, improve vascular flexibility, and over time, even enhance nerve sensitivity. The first point we will target is called the base groove, and it is located right at the root of your manhood, the exact spot where the shaft meets the pubic area. To find it, run your fingers along the underside of the shaft towards your body. You will notice a slight groove or indentation, almost like a natural hinge, where the erectile tissue merges into the deeper structures anchored in the pelvis. This area might feel slightly different from the rest of the shaft, a bit firmer or more textured, and that is because important anatomical structures converge here. Beneath the skin here lies a dense network of sensory nerve endings, including branches of the dorsal nerve of the penis, as well as key blood vessel junctions that feed directly into the erectile chambers. Consider it a control hub where signals from your nervous system and circulation converge. By stimulating this area, you are simultaneously activating both your nerve pathways and your vascular system, promoting better communication between your brain, your spinal cord, and your manhood. Here is how to properly stimulate the bass groove. Position your thumb directly over the bass groove while your other fingers cradle the back of the shaft for support. Begin with moderate pressure, enough to feel the tissue beneath your thumb, but never to the point of pain. Make small, slow circles, allowing the warmth of your touch to gently spread through the area. Gradually increase the firmness of your pressure, especially if you feel the tissue beginning to soften and relax. You might notice a pleasant warmth, a subtle tingling, or even a sensation of developing fullness. These sensations are your body's way of telling you that blood flow is increasing and that your erectile tissue is becoming more responsive. If you don't feel much at first, do not worry, as consistency is the key to success. Over time, daily practice will heighten sensitivity in this area and make the results more noticeable. For the best results, work on the bass groove daily in the morning, ideally before you even get out of bed when your body is naturally relaxed. A warm shower is another perfect time, as the heat will have already softened your tissues and improved blood flow. The second point we are focusing on is not actually on the shaft itself, but in a slightly hidden, often neglected area, the perineum. This is that soft, slightly springy patch of tissue located between the scrotum and the anus. Many men overlook it entirely, but in terms of erection strength and control, it is an absolute powerhouse. This is because it sits directly above the bulbospongiosus muscle, a key player in maintaining firmness once you are aroused. This muscle is one of the main muscles of your pelvic floor, responsible for trapping blood inside the penis during an erection. Think of it as a natural clamp that prevents blood from escaping too quickly. Over time, especially with age, this muscle can weaken if it is not actively engaged, making it harder to maintain strong erections. By applying targeted pressure and massage to this spot on the perineum, you can reflexively activate this muscle, essentially giving it a workout without even performing a full set of Kegels. To locate and stimulate the perineum, either sit in a comfortable chair or lie back with your knees slightly apart. Using two fingers, usually your index and middle finger, work best. Press gently but firmly into the center of the perineum. You are not pushing hard enough to cause discomfort, but enough to feel the underlying muscle respond. Move your fingers in slow, deliberate circles, staying centered in that sweet spot. As you massage, you may notice subtle sensations building, perhaps a gentle warmth radiating toward your penis or a faint pulsing as blood flow improves. That is your pelvic muscles waking up and your circulation responding. Spend 2 to 3 minutes here, keeping your touch steady and controlled. For an added boost, pair this with light pelvic floor exercises like Kegels either before or after the massage. This combination doesn't just help in the moment, it trains the muscle to contract more powerfully during arousal, making your erections feel fuller and more dependable over time. The third and final point is located in one of the most sensitive regions of the male anatomy, right beneath the head of the penis. This area is known as the glans, and more specifically, we are targeting the ring-like ridge where the glans meets the shaft, called the corona. This area is packed with an incredibly dense concentration of sensory nerve endings. These nerves are your body's main messengers for sending arousal signals to the spinal cord's erection center. When this spot is stimulated with the right balance of pressure and rhythm, it can heighten nerve responsiveness, making it easier to transition from arousal to a full erection. It is almost like tuning up your body's arousal circuitry, so it responds more efficiently when the time comes. This point works best when the stimulation is controlled, as too much intensity here can overwhelm the nerves and have the opposite effect. To properly stimulate the coronal ridge, gently take hold of your manhood with your thumb and forefinger, positioning them on either side of the corona. Lightly pinch the ridge and hold for about 5 seconds, and then slowly release. Repeat this hold and release action for roughly 1 minute, making sure to keep the pressure firm but comfortable. After that, switch to slow circular motions around the entire circumference of the corona, letting your fingers glide just enough to stimulate the nerve endings without causing friction irritation. This second minute of circular work helps to awaken the sensory pathways even more, encouraging faster signal transmission between the penis and the brain. Over time, consistent stimulation of the Glans Ring in this moderate rhythmic way can lead to stronger, more frequent morning erections. You may also notice an improvement in overall sensitivity during intimacy, making arousal feel more natural and spontaneous. The very best results happen when you treat these 3 points not as isolated tricks, but as parts of a single intentional routine. Here is the sequence I recommend to my patients for maximum benefit. First, spend about 90 seconds on the bass groove, making those small, steady, circular motions until you feel the area warm up and become responsive. Then, move to the perineum spot for 2 minutes, pressing and massaging in slow, deliberate circles to activate the pelvic floor and encourage deeper circulation. Finally, dedicate another 2 minutes to the Glans Ring, using that hold and release technique followed by gentle circular strokes to reawaken nerve sensitivity. Performed back to back, this sequence stimulates blood flow, engages muscle support, and sharpens nerve communication, all the key elements needed for firmer, more reliable morning erections. Now I want to set the right expectations, as this is not a magic button that transforms things overnight. Your body needs time to adapt, to retrain those blood vessels, muscles, and nerves to work together again harmoniously. However, many of my patients start to notice subtle but encouraging changes within just 3 to 5 weeks. Improved warmth and fullness in the mornings, erections that last a little longer, and a general feeling of increased vitality in the pelvic area. For truly lasting improvements, combine this daily pressure point routine with healthy lifestyle habits. Staying well hydrated throughout the day keeps your blood volume and circulation at their best. Keeping your pelvic floor muscles strong with exercises like Kegels adds to the firmness you will notice from this technique. And do not underestimate the power of nutrition, as it is the foundation of vascular health. When you make these steps part of your daily rhythm, the benefits tend to multiply. The points become more responsive, circulation improves, and your body begins to remember how to perform the way it once did. It is about creating an environment where strong, natural erections can happen more easily, and doing it in a way that is safe, drug-free, and completely within your control.